You're home from the beach and starting to relax when you realize that Ethan's skin appears redder than normal. As the hours pass, his burn increases. You applied sunblock before you went to the beach, but with all of that time in the water, it may just have been too much for his skin to take. Sunburn has struck. The American Academy of Dermatology tells us that the most common sign of the sunburn is redness, which can intensify for up to 24 hours. A severe sunburn causes skin tenderness, pain, swelling, blistering, fever, chills, upset stomach, and confusion. These symptoms indicate that the sunburn requires immediate medical attention. Be sure to see a pediatrician if any of these severe sunburn symptoms develop. For a milder sunburn, there are a number of measures that you can use to decrease the discomfort that Ethan may be feeling. First, a cool bath or shower. The Mayo Clinic suggests that adding 1/2 cup of cornstarch, oatmeal, or baking soda to the bath water may provide additional relief. Apply aloe vera lotion several times a day to the burn. Leave any blisters that develop intact to speed healing and lessen the risk of infection. If the blisters burst on their own, apply an antibacterial lotion or ointment on the open areas. An over-the-counter pain reliever such as acetaminophen or ibuprofen may help. Never give a child any aspirin product, as aspirin has been known to cause Reye syndrome in children under age 18. Never use petroleum jelly, butter, or other home remedies on a sunburn. These actually slow down the healing process. And most importantly, know the steps to keep Ethan from getting another dangerous sunburn in the future. The American Academy of Pediatrics reports that the sun is the main cause of skin cancer, the most common form of cancer in the United States. Most of our sun exposure, about 60 to 80%, occurs before we turn 18 years old. And research has shown that 2 or more blistering sunburns as a child or teen increases the risk of developing skin cancer later in life. Nobody likes a sunburn, so keep these simple rules in mind. The sun's rays are the strongest between 10 a.m. and 4 p.m. Try to stay out of the sun during these hours. Use sunscreen even on cloudy days. The sun's rays can come through clouds on overcast days. Look for a sunscreen labeled broad spectrum. This indicates that the sunscreen shields against both ultraviolet A and ultraviolet B rays. Apply sunscreen every 2 hours if your child is playing in the water, even those that say water resistant or waterproof. And apply the sunscreen 30 minutes before your child goes outside. This allows the sunscreen to work into the skin to provide the best protection. Sunburns aren't any fun, and they can be a bad ending to a really fun day. Know the steps to prevent them. But if your child has a sunburn, treat it quickly and keep them comfortable until it is past. Then you can both return to fun in the sun.